What are the boundaries of posterior triangle of the neck?
Anteriorly, posterior board of sternocleidomastoid muscle. Posteriorly, anterior board of trapezius muscle. Inferiorly, middle third of the clavicle.
Show me the muscle attachments of clavicle.
Sternocleidomastoid muscle attaches to this area. Pectoralis major muscle attaches to this area. And there is a groove for the subclavius muscle. Subclavius muscle attached to this area. And deltoid muscle attaches to this area. The trapezius muscle attaches to this area.
How did you identify the side of the clavicle?
Clavicle has two ends. Lateral end is flat, so this is the lateral end. And the medial end is large and quadrilateral. This is the medial end. Clavicle has a groove for the subclavius muscle in the inferior surface. So this is inferior surface and this is the groove for the subclavius muscle. And this is superior surface. The superior surface is smoother than the inferior surface. This is superior surface. So it has a slightly curved shaft. The medial 2/3 of the shaft is convex forward and the lateral 1/3 of the shaft is concave forward. So that's how I identified this is the right-sided clavicle.
What is the nerve supply to trapezius muscle?
Spinal part of accessory nerve.
Tell me another muscle supplied by the same nerve.
Sternocleidomastoid muscle.
How to test right side sternocleidomastoid muscle?
By placing right palm laterally on the patient's left cheek and asking the patient to turn his head to left side, resisting the pressure we are exerting in opposite direction.
How do you surface mark spinal accessory nerve?
A line joining 1/3 below upwards the posterior board of sternocleidomastoid muscle and 1/3 above downwards the anterior border of trapezius in the posterior triangle of the neck.
How to test trapezius muscle?
Asking patient to shrug shoulders while applying a pressure on his shoulders by our palms.
Other than that, what are the contents of posterior triangle of the neck?
Superficially, there are 4 cutaneous branches of cervical plexus: transverse cutaneous, supraclavicular, great auricular, and lesser occipital. Deeply, root of and trunk of brachial plexus, long thoracic nerve, dorsal scapular nerve, nerve to subclavius, subscapular nerve, subclavian artery, transverse cervical artery, suprascapular artery, and occipital artery are there.
How can you further divide anterior triangle of the neck?
It can be subdivided into carotid triangle, submental triangle, submandibular triangle, and muscular triangle.
What are the boundaries of carotid triangle?
Superiorly, posterior belly of digastric muscle, laterally, medial border of sternocleidomastoid, inferiorly, superior belly of omohyoid muscle.
What are the contents of carotid triangle?
Common carotid artery which bifurcates within the carotid triangle into external and internal carotid arteries, internal jugular vein, hypoglossal nerve, and vagus nerve.
How can you differentiate external carotid artery from internal carotid artery within the carotid triangle?
External carotid artery gives away several branches in the neck, whereas internal carotid artery gives no branches in the neck. Lower part of external carotid artery is situated anterior and medial to internal carotid artery. Internal jugular vein is situated just lateral to internal carotid artery in close proximity to it, but laterally in close proximity to external carotid artery is internal carotid artery.
What are the branches of external carotid artery?
Superior thyroid, ascending pharyngeal, lingual, facial, occipital, posterior auricular, maxillary, and superficial temporal arteries.